In our last video, we talked about how you can do a quick squat fix by getting your heels elevated, especially if you're in the middle of a workout. Obviously, it's not a fix because we're just trying to do it to get through the workout and making sure that our squat mechanics are great. But if you're looking at a reason why you might have that hunched over squat, so basically someone who looks like this when they're trying to squat at the bottom, I showed that in our last video. This might be a test that you want to do at home. It's called the knee to wall test, and you'll see why that is. And this is a quick way to figure out if ankle mobility is a limiting factor in your squat. Now, you can have other factors that limit your squat, like hip mobility, pelvic mobility, and also if you happen to be born with a longer thigh bone or femur than your shin bone, you're going to have a difference in how you look in your squat. And in that case, you'd have to adjust with lifting your heels up.
So let's get over to the knee to wall test
to see how our ankle mobility looks like. Now, before I forget, with any kind of mobility routine that you do, the key to success is making sure that you do this daily and doing it often. If you're planning on just doing one part of your day where maybe it's a minute or two in the morning, you're probably not going to get great results over time, and it's going to take you a lot longer to get any progress in there. So I would rather have someone do a minute here throughout the day, multiple times, 3 to 5 times in a day, than just once in a day, because they won't get the kind of results that they can get. So what you can do over here, get a tape measure, or a ruler if you need to. And what you want to do is first use your hand and place it between your big toe and the base of the wall over there, okay? And what I want to do over here in this position is try to get my knee to just barely touch the wall over here, okay? So from here, I'm going to lean forward, keeping my heel down. That's the most important part of this test. If your heel starts coming up, you're not doing the test correctly, and you're going to get a false negative, all right? So here, I'm going to allow my knee to come forward, and I can touch the wall, which is great. Cool. So now I'm going to take a look at where that set up, that measured. I am a little short. So if you're around 4 to 5 inches with your big toe away from the wall, you're in the normal range. If you're a little short of that and your heel starts coming up, then you know that ankle mobility is an issue that you're having. Now, the question you have to answer for yourself is, where am I feeling tightness in the ankle when I do this test? If you're feeling a lot of compression and stiffness in the front of the ankle, it's likely that you have a true joint mobility issue, and you should get that addressed at some point. There are some mobility drills I can show you that will help you to do this at home, but you may want to have someone take a look at that as well. If, however, you're getting some stiffness or tightness in the back of the ankle, that's more likely due to soft tissue like the capsule, which helps the ankle joint itself stay stable, or the soft tissue like the muscles and tendons that run through the back of the ankle as well. And that's a little bit easier to deal with, okay? So once again, you want to try to stay within 4 to 5 inches. And if you cannot get to that point, feel around for where you're feeling that. Is it the front of the ankle, or is it the back of the ankle where you feel it more? And now if you happen to have that sort of stiffness in the back of the ankle, here's a drill that you can work on at home really easily. What you have to do is go into that test position, which is kneeling, and get your body weight on top of your thigh bone. From here, all I'm going to have you do is keeping the heel down, like I said before, lean forward with your knee, hold that for a minute or so if you can, come back out of it. And now what's good about this particular exercise is, number one, you don't need any equipment. And number two, you can also go into different ranges, because we know that the ankle also rotates. So working your ankle in different ranges over here can be helpful in getting that position where you can keep the heel on the ground while your knee is bending forward. And I would say after a couple weeks of doing this, you should start seeing a difference in this test. And because you can do this at home, you can really evaluate yourself every couple of weeks to see if you're making any progress. So again, the key to this test, making sure that your heel is on the ground the entire time, that hopefully you're within 4 to 5 inches away from the wall. If you're not, just means that you have to work on your mobility. And if you're going to do mobility, make sure that you do this often throughout the day rather than one time a day for the best results. So hopefully that helped and figuring out why your squat might be limited, and I'll see you next time.